Hi, good morning or good afternoon. It is now 12:02 and I imagine you are on your lunch break and having your sandwich or whatever you brought from home, and I will be having mine after this is over. So good to have y'all join us. This is a special presentation for National Diabetes Month, which comes around every year in November. And this year the NIH has selected the topic of preventing diabetes. Which is very timely and very important because we have such a huge problem with diabetes. So we're going to be talking about that. As she mentioned, I am a registered dietitian and a certified diabetes educator. I am over here in the Kirkland Clinic. My little office is up here on the 4th floor of the Kirkland building back in endocrinology, and I've been here about 14 or 15 years. So happy to share what I know about preventing diabetes with y'all today. All right, so sometimes this little button doesn't work. I'll use this one. Okay, so why is it so important? Well, first of all, diabetes is rampant. We have a very high rate of it in Alabama. And you can see it kind of follows all the way down the Mississippi. And why that's a big problem is that it is the leading cause of heart disease. It's just leading cause of heart disease and diabetes. That's a typo there. It's the 7th leading cause of death in the United States. It's the #1 cause of kidney failure, lower limb amputations, and adult blindness. So it's a big problem. All right, let's see if I can get this little thing to disappear because it's on top of, whoops. All right. Okay, my screen sharing, resume share. Okay, let's just have to live with that. All right, so we're going to be talking about what even comes before diabetes, and it hasn't been too long ago that when patients went to their doctor, and you may have heard this yourself, they might have said, oh, you have a touch of sugar, or your A1C is up a little, or your sugar is a little high. And that was kind of like code for, we need to really start watching things. But and actually now there actually is a pre-diabetes diagnosis. And so pre-diabetes is its own thing, and it happens before people get diabetes. So it means your blood sugar is higher than normal, but it's not quite yet in the diabetes range. And according to the CDC, 88 million people have this, and most of them don't even know it. So 9 out of 10 people who have it don't even know they have it. And so it's a big problem because it increases your risk for getting diabetes within the next 5 years, 50% chance of getting diabetes if you take no action. And also pre-diabetes already increases your risk for a heart disease and stroke in of itself. So diabetes, so let's go to normal blood sugar. Down at the bottom, if you are screened for this and your A1C is under 5.7 and your fasting blood sugar is 99 or less, you're good. Your doctor's not going to mention anything. But now we have this category. It's been around a few years. If your A1C is between 5.7 and 6.4, now, A1C is the measurement, a lab test that measures your average sugar over the last 3 months. And you've had a fasting blood sugar that was somewhere between 100 to 125, or you had a random blood sugar or a glucose tolerance test, which rarely do we do those because they take so much time. But that's where you drink this syrupy stuff, and then 2 hours later they check your sugar. But even if you have a random blood sugar or one that's 2 hours after breakfast or something like that, if it's between 140 and 199, that's also considered pre-diabetes. And that's back in the day, they used to say, well, you have a little diabetes or a little sugar. It's not diabetes, but you have a little sugar. So now it's its own thing, pre-diabetes, and it actually has an IC9 code and everything. And then what'll happen is if you can stay in this zone for many years, and you can actually reverse it too. But if no action is taken, like we said, 50% of the folks that have prediabetes will develop diabetes in the next 5 years. So all those other problems, can ensue. All right, so the NIH has a campaign for healthcare providers to address diabetes prevention. So first of all, we got to identify who has it. So of course, that's through the screening process. And then once you know they do have prediabetes, you need to discuss it in frank terms. Don't use terms like, well, your sugar's a little high. Say you have prediabetes. And there are a couple ways that we can address that. One, if they're overweight, and most people will be, then you can set a weight loss goal for your patients, provide them guidance on exercise. Can you get out and walk? What can you do? And also you can refer them here to the Kirkland Clinic to meet with a registered dietitian. There are benefits for that with the UAB sponsored health plan. And we also have a DPP program, which I haven't really explained what that is yet, but we will. And that's a year-long program. It's a bit of a commitment for sure, but it's very successful. And that's over at Highland. So we have a couple options, okay? And then, we need to be following up with these folks at least annually to make sure they're not getting lost in the weeds. So we need to be screening people who are in the age of 40 to 70, and basically anyway, but anyone. But if you're overweight, you need to be screened. And if you are younger than 40, if you have any of these risk factors below, which there's quite a few of them, but if you have any of these risk factors below, you should be screened. Basically, screening just means that they're going to do, the blood test. There's a pre-diabetes risk test that you can take for yourself. And it's just a few simple questions and you get a certain number of points for it. And if you score 5 or more points on these questions, then you are high risk for pre-diabetes and you should ask your doctor about, getting the blood test, which is very simple to do. So you get so many points for your age. Men get a point for already just being a man. Women get 0 points for that. If you've had a history of having diabetes during a pregnancy, that's what they call gestational diabetes. That also puts you very high risk. Do you have a family history of diabetes? Do you have high blood pressure? That puts you at high risk. Are you physically active? Now we have to be honest about that. It doesn't mean just going for a walk on Saturdays. That's good, but that means doing some regular physical activity. And what is your weight category? So that it will kind of show you how many points you get depending on how much you weigh. All right. And then, like I said, if you get over a 5, you really need to kind of, hey, doc, I need to be tested for this. Okay. So body mass index is one of the things, that we measure all the time here in the clinic anyway. So most all of us know what ours is because you're told it every time you see your doctor. But if you have a BMI of 25 or greater, you are, somebody who should be screened for this. And then Asian Americans, if their BMI is only 23 or higher, that's actually considered overweight for that particular group. You can do an online calculation, but most people kind of know what theirs are these days. Right. And then this chart, I know it's really hard to see, but this is showing you whatever your weight is, if you can get some of the weight down. As we'll see, those are one of the helpful the tools, just knowing how much weight you should lose. Okay. So if you have pre-diabetes, what can you do about it? Okay. Well, yes, you can beat it. You can reverse it. You can prevent and delay type 2 diabetes. And there's a study that proved that that's possible. And you can also reverse pre-diabetes and get your blood sugars back down in the normal range. So it's not just like, oh, well, I've got it. Nothing I can do. Okay, no, you can do some stuff. So they had a big study that went from 1996 to 2001 called the Diabetes Prevention Program. And it was a controlled clinical trial conducted at 27 different centers all around the United States. And they showed that by people getting into this program and taking these actions, it was the program itself was a year-long program, that they reduced their risk for type 2 diabetes significantly, at least by 58%. However, for those folks who were over 60, it was even greater. They even had greater benefit, and that they kept this up for the next 3 years. And then there are benefits still being seen 15 years later. When you compare them to people who just were given a placebo, a fake pill basically, and didn't get the lifestyle program, they're still 27% more likely to delay the onset of diabetes from having done the program. Okay, so these are places where the DPP lifestyle change programs are all across Alabama. And of course, we have one here at UAB, which is good. But you do have some areas where people don't have any options. So luckily, some of these centers are allowing virtual participation, so that's good. But yeah, it would be nice to have one in every county if we could, wouldn't it? Okay. So what they found with the diabetes prevention program, there were two main actions needed to prevent diabetes and reverse prediabetes. For those folks who have the BMI of over 25, lose and maintain a weight loss of 5 to 7% of what you weigh. So that's not a whole lot, okay? So, 15, 20 pounds sometimes is all that they found was really needed. And got to get some regular moderate intensity, we'll talk about what that means in a second, of exercise, 150 minutes a week. You can spread it out however you want, and you can certainly do more than that. But they found that that's the magic number, at least 150 minutes a week. Okay, so as part of the campaign for National Diabetes Month, they've come out, there's actually a flyer on this of the different small steps that you can do to prevent diabetes. And they suggest, of course, don't try and overhaul everything about your lifestyle. Set small goals first. Really make a commitment to move your body more, choose better foods and drinks most of the time, and lose weight if needed. Track your progress in some way, whether you use some kind of a cell phone app or just journaling or marking things on your calendar that you went out and did that walking that day. They found that that's very useful because it kind of keeps you accountable. Make sure you get some support from your healthcare provider on this, and also friends and family and coworkers. You can have even a competition at work if you want to. And it's really important to try and stay up on your vaccines. I know that's a loaded, there's some loaded content there, but it is important because here's why. We have some data now that shows that, of course, you've probably read this or heard this, persons with diabetes are more likely to have a severe case of COVID-19. So you want to prevent from getting diabetes to avoid that. And we found that nearly 2/3 of all hospitalizations from COVID-19 were related to obesity, diabetes, hypertension, and heart failure. So those people tend to get the sickest. And then, of course, now we have some new evidence out, which is, more equally as scary, is that they're looking at the fact that they think that the coronavirus could actually give you diabetes, that they're looking at changes in the cells in the pancreas, that the virus can actually invade those cells and change how they function. It's like, great, just what we needed, right? All right, so what does the physical activity whole thing about? What can you do that counts as that? Well, lots of things can count in it. Walking at a good pace. So that doesn't mean just poking around, real slow, but, kind of having a pretty good pace. Hiking local trails, doing water aerobics, armchair exercises. There's a lot of things out there on YouTube now with that, which is great for people who have a sprained ankle, and can't get out and do their other exercise. Yard work, raking the leaves, all that stuff counts. Swimming, biking, any kind of sports, group exercise, streaming classes. So there was lots of things, even cleaning the house, dragging that vacuum cleaner up and down stairs. Yeah, that's some exercise. Washing your car or truck by hand. Okay. Dancing, even just, turning on the radio and dancing by yourself. That's fine. And yoga, of course. So these are all, good ways to get that exercise that we need. And it's best to not rely on one thing. It's best to have a nice little thing in your bag of tricks there. And these are just, of course, some of the types of exercise that, that are out there. Okay. And this is just a little infographic. I guess they picked a graphic that shows all the different benefits of walking. Walking is sometimes the easiest thing to do because you don't have to have special equipment, just good shoes. And it certainly will do the trick. So it's great for you for all kinds of things. It reduces all kinds of risks. Okay. So here's the deal. It's like, what the heck does moderate physical activity mean? Because it has to do with your heart rate. And so what it means is that your heart rate would be about 50 to 60% of your heart rate at rest. Additionally, excuse me, and it's an increase in that. So we have this thing called the talk-sing test, which is the easiest way to check if you're working at a moderate intensity. Moderate means that as you are doing your exercise, that you can still talk a little. Now, you may not be able to talk in a normal pace, but you wouldn't be, gasping for air in between your words. But you shouldn't be able to just belt out a song. If you can sing while you're exercising, then that you are not exercising at a moderate pace. You are exercising at a lower pace. Which may be fine. And obviously people who perform have to be able to do that, right? They have to be able to dance and sing at the same time. And then vigorous is, when you cannot say more than a few words without needing to get a breath. So that's kind of the two differences. There is a formula that you can use to get your maximum heart rate as well. And I've included that here. And of course, that is by measuring your pulse. Now, I'm never very good at getting on my wrists. I have to use the neck. But whatever works for you, that's fine. And there is a way you can calculate your maximum heart rate. So for like the example below, her resting heart rate, and so I have this thing that's kind of in the way of it. If I could get rid of that, that would be helpful. Oh well, I guess I'm just stuck with it. So 50% of her rate. I don't know. I can't see it. It's underneath a bar down here. Oh well, you can see it though. It's called the Carvonen method. So other ways to get active, again, if you do things with your kids, if you go to their sporting events or soccer events and stuff, don't just sit in your seat, pace back and forth. A lot of parents do that anyway because they're anxious about their kids' performance. Playing with your kids or pets, taking a few stairs here and there, coming up with a new active hobby, tracking your steps. All of us generally have this thing on our cell phones, which will track your steps for you. At least if you have an iPhone, it's got the little heart on it. And if you activate that, it will tell on you. It will tell you how much you walked today and how much you walked the same day last week, or are you doing more or less than you did? Now, of course, you have to carry your phone for that to work, right? Okay, so what are the most important tips for people who are needing to lose weight? Well, here are the four main ones. Eat smaller portions than you currently eat of those things that are high in calories, fat, and sugar. Okay, that makes sense. Eat healthier foods. Now we're finding that the word healthy foods is not popular. They say if you list that on a menu, that this is a healthy, people don't want it. So it's funny how it's like healthy, well, that's bound to be awful if it's healthy. But, of course, that's not true. It's just sort of a mindset that we kind of fall into. But choosing those healthier foods is getting more vegetables, beans, fruits, and whole grains over, French fries and burgers. And that's that takes some effort. It really does. It's not easy to eat healthy every day. I even struggle with it. You have to be mindful. You have to think about it. You have to plan. You can't just leave it up to, okay, what can I get out of this vending machine? Because, there's not anything there probably. And then choosing foods that are lower in fat, less added sugar. So you got to look at your labels when you have them to be able to use that information to make choices. And try and get away from drinking a lot of sugary drinks or dilute them. If you do have the option to use something from the fountain, if you get just a little squirt of the lemonade and then fill up the rest of the glass with just water, you're not getting nearly the amount of sugar than if you drank the whole, glass of sweet tea or lemonade. So that's really important. There's a lot of empty calories in things that we forget that we're getting every day with our meals. Okay, and some other tips: portion control, limiting the fried food. So this is just kind of sort of restating that the types of fats that you use are very important. And these are things that you would learn in a class or, coming to see a dietitian individually. And then another thing that we have to remember as professionals, when we just tell people eat fiber-rich foods or eat more fiber, a lot of people don't know what the heck that means. So I did include a little something about that in here. Okay, about how to get your fiber per day and where it comes from. So it comes from whole grains. We're going to discuss what those are in a minute as well. It comes from beans and peas, vegetables, fruits, and nuts. So like if you like to snack on almonds or peanuts, you actually get some fiber from a handful of nuts. So to get the amount of fiber that we're supposed to be getting a day, which is like between 25 and 35 grams, you pretty much have to eat these every day to get it. So as you can see, that takes, quite a bit of planning to get all that stuff. And I'll say right now, I'm not perfect. I don't get 3 vegetables every day. I aspire to that, but sometimes it's kind of hard to. I don't necessarily have time to eat them at lunch and supper, although that's certainly a good way to do it. Okay, so what the heck is a whole grain? Because people say, well, I eat wheat bread. Well, that may or may not be whole grain. Just the word wheat doesn't necessarily entertain that it is whole grain. Whole grain has to include the outside, the whole berry or the whole grain itself, the outside and the very inside too. And there's actually 22 different whole grains. I mean, who knew when you think about it? Some of them never even heard of, like, what the heck is fonio? Oh no, but there are some that are from, I've heard of amaranth. I don't think I've ever sat down and ate a bowl of it, but it has been in other things that I've eaten. Barley, buckwheat. Buckwheat is actually a grass. Bulgur, which is a form of wheat that is used to make tabbouleh and other things. Corn, and so on and so forth. So there's a lot of different ones, and we tend to only restrict ourselves to a few. Like most people are probably familiar with oatmeal, brown rice, and then whole wheat, but there's really are a lot of other things out there. And so it's good to challenge yourself to include more whole grains. But just remember, just because it says it's wheat bread or multigrain bread, that doesn't necessarily mean it's whole grain. It has to actually say 100% whole grain on there for it to be such. Now, if you don't like that, if you say, well, I've tried that and it's too chewy for me, you can get your fiber from beans and peas and fruits and vegetables, but it's not like you have to eat them, but it is a good way to get that fiber and all the other benefits. Okay, and then some guidance. We have myplate.gov, which is the good tools to know what are the portions you should be eating. So you can go on that. You can select a calorie level and get some guidance there. Okay, and so this is just a nice pictograph of that. And then this is more about how they teach you, or how you would learn this in a class as well. What counts as a serving of this or a serving of that? Because a lot of people are not very good at knowing what counts as a portion. Because if you say portion control, well, how do you know if you're eating too much? Okay, well, these are some good guidelines on that. Okay, and you can also, depending on the size of your hand, right? You can use your hand as a guide. A woman's fist is usually about the size of a cup. A tablespoon is usually your whole thumb, and so on and so forth. And then, of course, we all know what a computer mouse looks like. That is also like a pretty good reference for a moderate portion of meat, about 3 ounces. So that's another good way to know. And then however many nuts you can fit in a cupped hand is usually a reasonable serving size. Okay, and so this is more about how they categorize, like what counts as a serving of vegetables. Because people say, well, I like them. Well, let me tell you, what you get in one of those lean cuisines is not a serving of vegetables. They give you like 3 little pieces of broccoli, maybe. So, it needs to be a good bit more than that to count as a serving. So that's hard to get those 3 a day. You've got to do a lot of vegetable eating to get that. Okay, and then it's also a good idea to track what you're doing. And you don't necessarily have to do this every single day, but you could choose to do this for maybe 3 days in a row. There's some good evidence that if you track your own behavior with exercise and or what you're eating for 3 days in a row, that can give you a pretty good insight into, I always grab a handful of M&Ms out of that bowl when I walk past it. I didn't realize I was doing that. So that's pretty helpful. Okay, also, paying attention to if you're really hungry when you go to eat something. There's a lot of reasons we go eat something. We eat it because it's there, or we eat it because it was offered to us. Are we really hungry? Do we really need to eat? So that's important, to be mindful and be in the moment. And so you can rate how hungry you are with a little tool like that. Okay. And then, of course, we got to keep ourselves busy so we don't mindlessly eat. So, some people need to keep their hands busy. Other people just need to be more socialized. I think people just being left at home, not being able to go anywhere during the COVID quarantine. There was a lot of weight gain during all that. People were bored and they were trying all these new recipes, and which is fine, but then they were eating it all too. So that's a problem, I think. Okay. All right. So now we're going to get into what are the activities that are here at UAB and also in our community to help support us in our quest to prevent diabetes and keep ourselves, in good shape. So we do have access to appointments with registered dietitians here at the Kirkland Clinic. You do have to be referred by your healthcare provider. And of course, that can be a nurse practitioner. It doesn't have to be a physician. It can be even a PA if that's who you see on a regular basis. But they do have to actually put you a little referral in the computer to us. There's also a diabetes prevention program. They're in the middle of a session right now, but they will be starting up a new group in January. And that is going to be over at Highlands at UAB Weight Loss Medicine. That's where the diabetes prevention program is now. And then, of course, we have my health rewards program. I know you all know about that. So that's definitely, you get that as a financial benefit of doing what you need to do there. Right. And then, UAB provides psychosocial support through the EACC, the Employee Assistance and a Counseling Center, which is free to UAB employees and members of your immediate household. And so there's a lot of services there that I think some of us just forget that we can, latch onto and benefit from. So that's a wonderful benefit. Okay. And then UAB supports us being more physically active. They actually offer us discounts to different gym facilities. And I must say, I wasn't aware that you could get a discount to Orange Theory. I didn't realize that. I just thought it was UAB and the Y. And people love the Y because the Y has that silver sneakers program too that's really beneficial. And then, of course, we have lots of walking trails all over campus. And of course, you can walk and get your walking in without ever having to go outside if you just go through the facility. Okay. And they actually have discounts for shipped grocery delivery. So that's a nice benefit. I wasn't aware of that one either. We do have wellness meals over at the North Pavilion Cafe. They always have fresh fruit now, and fruit and chicken salad plates. And then Panera has a lot of good offerings, and Chick-fil-A has really good grilled chicken salads. The one that they have that has the blueberries and the strawberries on it is really, really good. And then, we also have that wonderful Midtown Publix. That's a good way to get a little walking in on your break. Go over there and you can, they have a nice grab and go area, or you can stock up on healthy things to keep in your break room. So got some good support here. Okay. And so no matter what, what you're trying to do, it's really helpful to have specific goals in mind. And so you want to have your goals to be, attainable. You don't want to make something that's so complicated that, you're never going to be able to do it. So they call them SMART goals. So specific goals, measurable, like what exactly are you going to try and do? I'm going to try and eat one more vegetable a day. And again, make it kind of something that you can do. And reward yourself for a goal. It's really important to pat yourself on the back for a goal that you've met. Very, very important. And kind of set yourself a timeline as when you will achieve this. Okay, so by the end of this month, I will have eaten at least one good vegetable at lunch, at least 3 out of 5 days a week. Something like that, I think would be really, really helpful. So, check to see, do the risk test for yourself, talk to your healthcare provider, find out what your labs are. Do you have prediabetes? And then, get the support that you need to take the action to prevent diabetes, because it's important for you. It's important for our whole economy, because diabetes, people with a lot of diabetes out there, really increase the healthcare costs for all of us. And then, of course, I forgot to mention, it is very important, if you can and are so inclined, join the All of Us program, because the data that they collect from us on that is being used by researchers to figure out better ways to help treat and prevent and cure all these different conditions that are plaguing us. All right, and so I went to look to see, well, what is our current administration doing? And there's actually a proclamation that President Biden put out October 29th. And these are things that, not necessarily that we're doing right now, but, like a wish list, I guess you could say. So they're asking for Congress to fund a new agency, the ARPA-H, and it will help accelerate research on detecting, treating, and curing diseases like diabetes and Alzheimer's. And of course, UAB would be one to benefit from this kind of money being available. And then, of course, we have the American Rescue Plan that was designed to, at least in part, to help shore up public health infrastructure, combat hunger and food insecurity. You probably have seen how we have areas they call food deserts, where people who live in that area do not have decent grocery stores. All they have are, quick marts. And that's not good. If you can't get to a grocery store, it's hard to eat pretty healthy, right? And then, of course, there's always been this ongoing battle, and maybe they can get somewhere with it, where they're asking Congress to allow Medicare the power to negotiate prescription drug prices. And that's going to be really important for our folks who already have diabetes and need insulin. Our benefit here is really good for insulin coverage, but we talk with many patients that they say, I wish I could afford that good insulin my doctor recommends, because I know it'd be really helpful, but it's $150 per month, and I have a lot of other medicines I have to buy. So it's either, do I pay my rent or do I buy my insulin? Yes, we have created some legislation. I don't know if it's actually enacted yet, where they're supposed to be capping the price of insulin to no more than $100 a month. That's nice, but a lot of people are on two kinds of insulins, and now that's $200 a month just for your insulin. So seems like I know in Colorado the cap is $35, so I guess we didn't have the stomach for doing that. But and anyhow, these are things that that we're that they're hopeful to do. So really that's it. It's pretty short. So you've got time for lots of questions if you all have them. And then also the some of the resources here for you to give you some good tips, like MyFitnessPal. That's one of the apps we were suggesting that's really helpful. And a lot of people do like MyFitnessPal. It has all kinds of things in there to help kind of keep you on track with your efforts. So